Somewhere over the clinical rainbow, transgender psychosocial factors and levels of response. Hello, this is Dr. Brent Satterley, and I'm going to talk to you a little bit about the experiences of transgender persons and some of the psychosocial factors that may affect their lives and your experience of them as clinicians. Before we do, I always have to talk a little bit about language and some of the both insufficiencies and generalities of language. We've already talked a little bit about that in some of the organizing constructs of gender and gender identity, in that the English language is insufficient to actually capture a wide variety of the ways that folks experience, express, and identify with regard to gender, and that sometimes people get that a lot confused with sexual orientation as well as intersex experiences. So today we're talking specifically about transgender experiences as well as gender variance. So some transgender psychosocial issues that are important to recognize: isolation, depression, anxiety, addiction, familial and societal rejection, domestic violence, poverty, abuse, and suicide, just to name a few. It is particularly concerning. Green noted that the National Transgender Discrimination Survey from 2011, largest study of its kind, surveyed 7,000 plus transgender persons and really identified places of public accommodations being one of the most common areas where people of transgender experience discrimination. That is, public restrooms and or other areas of public accommodation is not uncommon. Now, that is just one example. Obviously, a number of these other psychosocial factors are pretty significant in the context of the impact that they may have, certainly, with regard to how they present themselves in your offices. I want to give you a great example of LGBT youth as an exemplar of some of the challenges. The Human Rights Campaign did a study earlier in the 2012 asking LGBT youth, what's the most difficult problem facing you in life currently? And one of the things that they talked about was my parents and family not accepting, 26%, trouble at school and bullying, 21%, afraid to be out and open, 18%, self-harm, depression, suicide, eating disorders, 14%, in general, being LGBT, 12%, etc., etc. Pretty significant stuff. They asked them the same question of non-LGBT youth, and as you can see, some trouble with classes, exams, and grades was the top factor, 22%. College and career decisions, 17%. Financial problems, paying for college, getting a job, 14%. Family stress, pressure, 10%, etc., etc. So those are pretty significant differences just between LGBT youth and non-LGBT youth. It's really just an exemplar, and I want to dive a little further into that for trans youth. Dr. Rocco Salsa identified a number of very concerning statistics in a qualitative study from Philadelphia. 96% of his subjects reported verbal harassment at school, 83%. Physical harassment, 75% didn't feel safe, dropped out, 21% self-mutilated, a staggering 71% were sexually assaulted, 46% engaged in sex work for survival, 75% used alcohol and drugs. This is certainly alarming and concerning, and we can understand where some of these statistics come from in light of the nature of transgender discrimination that occurs both in the context of families when transgender youth get thrown out of their homes or get rejected from societal experiences. Let's talk a little bit about LGBT youth and suicide. As we've already talked about in the context of other modules, some of the sources of oppression, homophobia, heterosexism, biphobia, and transphobia, more specifically in this module, we know that LGBT youth are 5 times more likely to attempt to commit suicide. But 83% of transgender youth have had thoughts of suicide, and 54% have actually attempted suicide. If you're not alarmed by that, you're not really paying attention. It's a significant epidemic and concern, and it needs to be addressed and brought to the attention of clinicians who are often on the front lines working with individuals who are addressing these things. Some new CDC data from 2015, the Youth Risk Behavior Surveillance Survey, talked about an increase in these things. And Deborah Hauser from Advocates for Youth mentioned in the wake of great political and cultural gains for LGBT Americans, LGBT youth continue to face bullying, harassment, and sexual assault that leaves them feeling afraid and hopeless, and 5 times more likely to attempt suicide than their heterosexual peers. 60% of lesbian, gay, and bisexual youth responding to the risk survey reported feeling so sad or hopeless that they stopped doing some of their usual activities. 40% seriously considered suicide, 30% tried. As you may imagine, the transgender youth experience for this was even higher, as reported previously, a significant concern. As we know, 40% of homeless youth are LGBT, and the number one reason that they're on the streets is, in fact, family rejection. And LGBT people are more likely to be a target of hate crimes than any other minority group in the United States today. I do want to highlight the importance of resiliency coming from a strengths-based perspective. Often transgender people have to cope with systemic and microaggression on an ongoing basis, and yet they also end up really finding a lot of strength in community and community connectedness. And one example of that is the experience of school belonging, and it's a recent study from 2018 that looked at intersectionality and resiliency among transgender adolescents and explored pathways for peer victimization, school belonging, and drug use. And they identified the fact that often many transgender youth experience victimization, peer victimization, and as a result, drug use increased, especially among youth of color. That they don't often engage in greater drug use than their white transgender peers if they have an experience of belonging to a part of experience of feeling they're part of something at school. Those concerned with healthy futures of transgender youth should advocate for more open and affirming school climates that engender a sense of belonging and treat transgender youth with dignity and fairness. In other words, in order to help transgender youth, we want to be able to advocate in school systems, organizations, attending school board meetings, in order to be able to try to help enhance ways for transgender youth to feel a part of their experience at school. Personal is political. Unfortunately, we know the case of Gavin Grimm, who is now 17, who was trying to simply use the restroom that accorded with his gender identity, and he identifies it, and he was not allowed. And so, I'm just a human, I'm just a boy, please consider my rights when making your decision. Respectfully to the school board of Gloucester County, and unfortunately the Trump administration withdrew the Title IX guidance supporting transgender people within higher education. And the Supreme Court subsequently decided to send the case of Gavin back to the Fourth Circuit for reconsideration. This decision will likely then delay any kind of constitutional protection for transgender students, and has subsequently left states free to continue to enact discriminatory legislation like HB 2 in North Carolina and SB 6 in Texas, all of which are considered bathroom bills. And as a result, that process can result in the experience of discrimination in education for many transgender students. As you can see, the hundreds of thousands of transgender students received a clear message. The law was on their side, and subsequently, by rescinding the guidance, the Trump administration has taken the opposite stance. They've sent a deeply troubling message for students that the administration will not stand up for students' civil rights. This is from a number of organizations that formed a coalition, the Leadership Conference for Civil and Human Rights, the National Center for Transgender Equality, GLSEN, the National Women's Law Center, the NAACP Legal Defense and Educational Fund, ACLU, HRC, and the MALDEF. So a lot of concern about that. This brings us to the notion of a particular assessment tool called the levels of response, a systemic analytic scale that assesses the responses of individuals, organizations, and communities to LGBT people. In this instance, we're going to apply it specifically to transgender persons. The first stage is rejecting punitive. transgender folks are evil and should be punished. Disturbing report that was issued by the Human Rights Campaign and the Trans People of Color Coalition highlighted that more transgender people were killed in the first 6 months of 2015 than in all 2014. While we don't know many details about the victims' experiences, research shows that transgender people face harassment and discrimination in numerous contexts throughout their lives. Moreover, we know that chances of facing discrimination, harassment, and violence increase exponentially for transgender women of color who also face racism and sexism. We do know that the experience for many transgender women of color is one of significant risk of violence throughout the country, and we can see that tragically we have seen that statistic has actually increased over the course of the last 2 years. Rejecting non-punitive. Transgender folks are sick and need help to change. The notion of individuals who really view this as a problem to be fixed, either in the context of therapy, might say they see gender variance as a problem to be fixed with psychotherapy, surgery, aka pick a side, or by simply conforming to traditional gender identity expressions. Why don't you just get with the gender binary program? In other words, act like a man, act like a woman, etc., etc. Unfortunately, we also see sometimes that this attitude can sometimes lead to things like sexual assault. I'll show you you're a man, etc., etc. Very concerning. Qualified acceptance. Don't Ask, Don't Tell, or the Netflix series Parenthood. Transgender folks are okay. I just don't want to encounter it. The whole notion of what it means to not really want to deal with and or experience transgender people and acknowledge their own personal experience. Not parenthood, transparent, and that is a great example of the notion of, well, they're fine, I just don't want to deal with it, don't want to encounter it, don't want to see it, etc., etc. Full acceptance. Transgender folks are a normal and natural part of our community. Human Rights Campaign is a good example of that. While they didn't necessarily used to be great trans advocates, they certainly are working towards it at the present time. And here's a great picture of two parents in a LGBT pride parade advocating for their trans child. And finally, advocacy. Transgender folks are a normal and natural part of a community, and their rights should be protected. This really is all about taking action. The two specific sources, one, the National Center for Transgender Equality, does tremendous work advocating for transgender rights and the rights of gender variant persons. And the I'll Go With You campaign basically has to do with going back to Green's comment specifically about the notion of recognizing that areas of public accommodation like public restrooms are often where people experience discrimination in a significant factor. So I'll go with you to the bathroom to make sure that you're safe and okay, and you can use some of the basics of human functioning, like use the restroom. Some of the implications here, the levels of response is a tool that's used to assess individuals, families, organizations. It helps allow for clinical assessment both personally, organizationally, professionally, and really gives you a chance to look at your clients, families, and your own organization that you work at. So I pose to you, assuming that you were a transgender or gender variant individual, or you loved someone who was or is, what level would be enough for you? In other words, what level of response would you want people to give you in this context? So the next steps, the next part of the module is to address midlife and older adult transgender experience. So enjoy. Take good care. Bye-bye.